Welcome. I'm Daniel Webster, Bloomberg Professor of American Health and Director of the Johns Hopkins Center for Gun Policy and Research.
And I'm Dr. Cassandra Crifasi, Assistant Professor and Deputy Director of the Center.
Thank you for joining us as we celebrate the silver anniversary of the Johns Hopkins Center for Gun Policy and Research. Throughout the symposium, we'll share some reflections on the history of the center and highlight some of our recent work. We're also excited to share some important announcements and future directions of our center for the next 25 years.
We wish you'd been able to come together in person to celebrate this important milestone, but having the celebration virtually has allowed more folks to join us, including family, friends, and colleagues from across the country. In fact, hundreds of people registered to join us this afternoon, and we are so pleased to have you here with us.
We're going to kick things off with a welcome from Johns Hopkins University President Ron Daniels, the Bloomberg School of Public Health's Dean, Ellen McKenzie, Vice Dean Josh Sharfstein, and Michelle Spencer, Associate Director of the Bloomberg American Health Initiative. Then we'll hear from some special friends who are going to reflect on the center's history, including some who were integral to its creation 25 years ago.
Good afternoon, and congratulations to the Johns Hopkins University Center for Gun Policy and Research on an extraordinary 25 years. When the center was founded in 1995, the United States was reeling from historic levels of gun violence. Just 2 years earlier, 18,253 people had died of firearm-related homicides, a historic peak. What made the center stand apart was how it approached rampant gun violence in the United States, not as a war to be fought, but as a public health crisis to be managed with sound data and deeply reasoned public policy analysis, propelled by the knowledge that underlying these data are human lives. In the years since, the center has never ceased to embody this charge, continuing to be a vital source of clear-eyed insight into one of the most highly charged issues our nation faces, both in times of hope as well as in times of unbearable tragedy. I had a chance to see this up close in January 2013, when the center pulled together in record time a sweeping 2-day summit that gathered experts from around the world to propose policies to reduce gun violence. Held exactly 1 month after the horrific shooting at Sandy Hook Elementary School in Newtown, Connecticut, the conference and the book that emerged from it, which landed on every single member of Congress's desk, helped strengthen gun control laws in multiple states, making clear that the center's unique blend of data-driven analysis and profound humanity can drive change. Today, the mission and the work of the center remain as critical as ever, whether here in Baltimore, where the center remains a resource for city leaders implementing research-based, effective and focused violence reduction programs, or in communities around the country, and indeed the world. To Daniel, Cassandra, and all those affiliated with the center, thank you truly for your quarter century of life-saving work.
We have come a long way, yet you continue to deal with the social and political forces that make your work particularly challenging. To your credit and success, you have always brought science and evidence to the debate. Through its work over the past quarter of a century, the center has defined gun violence as a public health problem. Now, this seems obvious to us now, but it took pioneers like Steve Terrett, Dan Webster, Jan Wernick, and many others to change how we think about gun violence and demonstrate what can be done by thoughtful application of public health principles to the problem. And along the way, you have trained dozens of the researchers and practitioners who are now leaders in the field.
Congratulations to the Johns Hopkins Center for Gun Policy and Research. 25 years. Wow. I remember back when you were still an adolescent, helping to guide a young health commissioner to figure out how to tackle gun violence in Baltimore, leading to the Safe Streets program that we know today. I also remember when you were a young adult, guiding Maryland in the wake of the Sandy Hook shooting to a gun licensing law that has been very important for the state. Now you're 25, in the prime of your youth, able to do great things. The first water-wheeled turbine was invented by a 25-year-old. The first 4-minute mile was run by a 25-year-old. I could be wrong, but I think Charles Lindbergh crossed the Atlantic by himself for the first time when he was 25. Now you have a great team, a great set of partners, the right public health goal, and a world that needs you. Happy birthday.
Your work over the last 25 years has informed policies, implemented and evaluated community-based violence prevention programs. You've advised government officials, advocated for safety of our schools and communities, from Safe Streets here in Baltimore to the Violence Prevention Program in New York, from modeling to evaluations, from congressional testimonies to teaching and mentorship, from practice and research. You have been there. This work is not easy, yet you persist. You are our champions.
Our foundation has supported and learned from the center since its earliest days. In fact, during a quick search, I realized that our first grants were way back in 1993 and 1994, when it was certainly not common to think of gun violence as a public health issue. Now, of course, that view is taken for granted. With the dedication and great leadership of Daniel Webster, the center can take credit for building the field, for training young scholars, providing clear and relevant information to policymakers, advocates, and to funders. The center has never rested. It always sought ways to expand and to tackle new issues. For example, research on how to use technology to reduce gun violence, to better understanding the views of gun owners on policy issues, and the critical importance of including community and neighborhood voices in the policymaking process. Most recently, Joyce has supported the center's seminal studies on the effectiveness of state background checks and the impact of permit to purchase on their effectiveness. It is with great respect that I convey, on behalf of the entire Joyce Foundation, our congratulations on this milestone event.
25 years ago, the Joyce Foundation was thinking about starting a program on gun violence prevention, the first such program in the country. So I was working there, I read a lot, and I kept coming across articles by this guy, Stephen Terrett, that were really smart and perceptive. So I called him cold and asked if he would meet with me, and Steve, as you know, was unfailingly generous. We talked and talked and talked, and I was just so impressed with his brilliance, his commitment to reducing gun violence in America, his passion for the issue, and his creativity. So I said, think big. Forget that we had guidelines, forget about the amount. What is it you would like to do to reduce gun deaths in America? And he was a little startled, but he thought about it, and then he said, I'd like to start a center here at Hopkins on gun policy and research. Now, for the Joyce Foundation, that was fantastic. It aligned perfectly with our priority of refocusing gun violence as a public health rather than just a criminal justice issue. And obviously, to have a center at one of the leading schools of public health in the country would be wonderful. Steve brought on an amazing staff, Daniel Webster, Jan Wernick, and others, and had a terrific group of colleagues, Garen Wintemute, Steve Hargarten, who we mentored and partnered with. And 25 years later, we have the leading center on policy and research to reduce gun violence in the country, a place you can rely on for data, for great ideas, for creativity and reliability. It's really a remarkable achievement.
You know, Hopkins' leadership on this issue goes back even further, back to 1980, when Sue Baker and Steve Terrett and Park Dietz published Firearms and the Public Health in the Journal of Public Health Policy. The Gun Center was built on the firm foundation laid by such early work, ironically taking its place just as an NRA-led effort in Congress largely choked off federal support for research on firearm violence in the mid-1990s. So who cuts off support for research in the middle of an epidemic? Those were lean times. Many people left the field, but not the crew there at Hopkins. And now you are leading a nationwide resurgence. You're doing some of the best and most impactful research in the country, teaching others how to do it and how to use it, working to translate research into effective policies and programs. An early alum of the Hopkins effort, having been a master's student there in 1982-83, it's a real pleasure to acknowledge that our programs here in California are very much part of the legacy of the ongoing effort there at Hopkins. It is an honor and a pleasure to be your colleague, your friend, and on occasion, your foxhole buddy.
I'm a public health lawyer, and one thing that has always been really a unique contribution of our gun center is its early recognition of the importance of law and policy in furthering gun violence prevention. And that focus on law and policy has allowed me to do things that I'm really proud of in my career, including focusing, of course, on the evaluation of gun laws in collaboration with people like Daniel Webster and Cassandra Crifasi, working on evaluations including an evaluation of Maryland's Saturday night special ban, and of course of gun licensing laws, which our center has become known for. But our focus on law has also included things like helping states and the federal government and localities to design and implement the most effective gun violence prevention policies.
My career began as a doctoral student at Johns Hopkins Bloomberg School of Public Health. Because of my interest in domestic violence and homicide prevention, I was assigned Daniel Webster as my faculty mentor. And I was put to work on projects for the Johns Hopkins Center for Gun Policy and Research pretty immediately. And this was back in 2002, where there were very few places around the country where a doctoral student could be specifically trained in gun policy research. I am very fortunate to have had that experience. It has informed everything I have done in my career. After graduation, I continued and still continue to collaborate with center faculty, specifically Daniel Webster and Shannon Frederoli, and we have produced rigorous, high-quality research on domestic violence-related firearm laws. This research has informed policy and been impactful. And having an impact through your research is what we all hope for. And the Center for Gun Policy and Research consistently puts out that high quality, rigorous, impactful research.
One of my most memorable projects with the center was a mixed methods and multi-pronged analysis of gun law enforcement in Baltimore that included engaging with community residents to hear firsthand about their interactions with law enforcement and learn from their lived experiences to provide recommendations to the city to improve violence reduction efforts. That project, along with several others where we worked alongside local practitioners and leaders, impressed upon me the utmost importance of listening to and grounding scientific research in the needs and concerns of those most impacted by violence. My hope for the center's future is that it continues to center equity and racial justice in all of its endeavors, and that it provides even greater accessibility of the impactful and translational research done there to communities, policymakers, and leaders nationwide devoted to gun violence prevention.
I want to thank Steve Terrett, founding director of the center. Steve had a huge impact on so many of us working in the field. Within our center, Steve mentored Jan Wernick, Shannon Frederoli, and myself, and his former student, Dr. Darren Wintemute, has been a superstar in the field for decades. Steve, brought on a stellar group of affiliated experts to guide our work in the early days. These were the top researchers in the nation who were focusing on gun violence prevention. As a then young researcher, having these relationships provided a great advantage to me in the years ahead. Jan Wernick has contributed so much to the center's success since its inception, providing leadership as co-director for a dozen years and leading legal research that served as a foundation for many studies on the impact of gun laws. The lack of gender and racial diversity among researchers focused on gun violence was a huge problem 25 years ago. I'm happy that in 2021, many of the leaders in the field are female, several of whom got their start at Hopkins. Our center is committed to expanding the number of underrepresented minority researchers focused on gun violence prevention now and in the years ahead.
It's an honor to be part of the expanding diversity of researchers in the field. I'm proud of the role our center has had in supporting the growth of researchers focused on gun violence prevention. When reflecting on the center's history, that's one of the things that makes us unique. We don't just focus on producing high quality and policy relevant research. We also train the next generation of researchers, advocates, and those implementing programs and strategies to prevent gun violence. This also highlights the importance of continued support from foundations like the Joyce Foundation and private donors in supporting and sustaining the work of the center.
Up next, we'll have our first panel discussion. Nina Wernick, Director of Gun Violence Prevention and Justice Reform at the Joyce Foundation, is going to moderate a discussion between center faculty members Dr. Shannon Frateroli and Alex McCourt and you, Cass, about some of the gun policy research efforts you have been leading in the center. After the panel discussion, we'll be joined by some special guests who will reflect on the importance of using our research and share experiences about how the center has directly impacted their work.
I'm so delighted to be here to help recognize and celebrate the 25th anniversary of the Center for Gun Policy and Research at the Johns Hopkins Bloomberg School of Public Health, and to hear from some of the work underway by the center's researchers. One of the real strengths of the center is its focus on connecting research to policy. This panel offers 3 timely examples of the center's work on topics that are subject to present-day debate and discussion by policymakers, advocates, law enforcement, and community members. The 3 topics we'll cover are extreme risk protection orders, firearms licensing, and ghost guns. Dr. Shannon Frateroli, let me start with you. Can you explain for us what are extreme risk protection orders and what are you learning about them in your research?
Sure. Extreme Risk Protection Order laws, or ERPO, are a civil order that allows people who are on the front lines of witnessing violence to go to a court and ask that the court temporarily prohibit a person from purchasing and possessing guns while that crisis that they're in is underway. So ERPO laws are now in place in 19 states in the District of Columbia. And what we're really looking at from a research perspective now is how to assure that the implementation of those laws is happening in a way that's going to maximize the public health benefit from them. So ERPOs are a new kind of law. So making sure that law enforcement, including the courts, frontline law enforcement who petition for these orders, serve the orders, and help to dispossess people temporarily of their firearms, they really need support and technical assistance to learn how to do those processes and do them in a way that's going to adhere to due process protections under the law and be mindful of the need for equity in the implementation of this law. So our research is really focusing on that crucial implementation question of how can we assure that these laws are being used in a way that's going to maximize the public's health.
And for states that don't already have ERPOs. What are the public health benefits, and what should policymakers in those states be thinking about as they contemplate enacting ERPOs in those places?
Great question. Well, when I think about the benefits of ERPOs, a couple things come to mind. One is that they're based on domestic violence restraining order laws. And we know from decades of research in that space that when you remove guns temporarily from domestic violence offenders, we see statistically significant reductions in intimate partner gun homicides specifically, and intimate partner homicides generally. So there's good reason to think that ERPOs, which essentially work through the same mechanism, will also have good effects. I've looked at ERPO petitions in many states at this point in time, and it's always striking to me really how severe the crises are that people are in that prompt someone to come before the court and ask for protection.
Thank you, Dr. Frateroli. It's wonderful to hear that so many policymakers are really paying attention to that research. Let's switch gears now and go to Dr. Cass Crifasi. And Dr. Crifasi, I'd like you to tell us about firearms licensing. This is a policy that's been around for a number of years, but it's getting renewed attention just over the last few years. What is firearms licensing, and what are you learning in your research?
So licensing systems are laws that states in the US have put into place to build out a more robust system to identify and screen out individuals who are prohibited from owning a firearm. This could be because of criminal history or mental health related conditions. These systems involve an application to state or local law enforcement. As part of that application, individuals often submit fingerprints. Law enforcement use more records than may be available under the federal system, and they also have more time to complete those background checks, which fills an important gap in federal law. These laws require that no matter who you want to purchase a firearm from, you must first have this valid license that you show, which can increase accountability in the way firearms move from lawful sales and then potentially into an underground market. What we're learning from our research is that there is substantial public safety benefits when licensing laws are in place. For example, we see fewer guns available for use in crime. We see lower rates of firearm homicide, including mass shootings. States with these laws have lower rates of firearm suicide as well, which may be due in part to delaying impulsive acquisition of a firearm that could be used to harm oneself. We see lower rates of law enforcement officers being shot in the line of duty. And importantly, we have some new work that's coming out that shows that states with licensing laws, strong licensing laws, have lower rates of civilians being shot by police as well.
Those are incredibly powerful findings. How can policymakers act on what you're learning?
It's a great question. So what we've seen from repeated research studies, looking at different study designs, different units of analysis, different outcomes, is overwhelmingly licensing laws have very significant public safety benefits. But beyond the research evidence, we actually see very broad public support for these laws as well. When you ask a nationally representative sample of adults their perspectives on these laws, you see more than 75% of US adults support requiring prospective gun purchasers to first get a license. This includes more than 60% of gun owners being supportive of these systems. If you look at states where licensing laws are already in place, where presumably gun owners have experience functioning in these systems, the support for licensing laws jumps to more than 75% among gun owners. Another key group that we've looked at is support among African Americans living in metropolitan areas. This is a demographic that experiences disproportionately high rates of gun homicide, and support among this group is at 80%.
It's so important to track not just effectiveness of the policies, but also how the policies are perceived by members of the public who are going to be impacted by them. Thank you very much, Dr. Crifasi. Next, Dr. Alex McCourt. Dr. McCourt, you've done a lot of thinking about ghost guns. Can you tell us what are ghost guns and what do we know about them?
Sure. So ghost guns are untraceable firearms that can be assembled by consumers at home. In most cases, these are either 3D printed or they're constructed from component parts that can be ordered as part of a kit or separately. These guns, unlike your typical gun, are not traceable. They lack serial numbers and other markings that would allow law enforcement to identify the original manufacturer or seller. These kits and the code needed for 3D printed guns are often marketed as a way to construct an unregistered, untraceable, but functioning gun in very short periods of time, ranging from just minutes to hours.
And what do we know about the use of ghost guns? Are law enforcement agencies recovering these types of guns, and how big a problem is it?
We know that law enforcement agencies are recovering these guns. There are kind of sparse anecdotal reports of them being used in crime, them being recovered in crime. But because they're not traceable, there's really very little data. As a result, we have very little research on ghost guns. This is one of the problems, is the lack of data. And another problem, I think, is lack of awareness. So those are two areas that we're really trying to focus on in our work. The first is collecting data and synthesizing it to understand the scope of the problem. But also, we're trying to raise awareness by creating educational materials so that members of the public and policymakers can learn about ghost guns.
This sounds like an incredibly important issue and potentially a big problem. What is it that you hope policymakers might do to address the issue of ghost guns?
I think there are a few things that are really important for policymakers to keep in mind. The first is maybe the way that ghost guns subvert all of these other gun policies that we've talked about. So we know the least about ghost guns, but one big problem with ghost guns is that they can be purchased without a background check. So if you want to purchase one of these kits, you can do so without undergoing a background check. So even if you're otherwise prohibited from possessing a firearm, you can buy the component parts or you can buy a ghost gun kit and you can make it at home. One big problem with this is that the benefits that we're seeing from purchaser licensing and even from ERPOs are maybe kind of subverted or may not be as beneficial if people are able to access these guns that shouldn't otherwise be able to. So that's really important for policymakers to understand. Another key thing is that there are some states that have adopted policies to regulate ghost guns. The approaches vary. Some states have tried to just ban them entirely. Other states have tried to require ghost gun owners to come in and add serial numbers to their guns. But most importantly, because we don't have data, we don't know what the best evidence-based policy is. We don't know what the most effective policy is. So what I think is really important is for policymakers to try to gather data and make this data public. We need reliable public data that documents the use of untraceable ghost guns in violence.
Thank you very much, Dr. McCourt, and thank you all. The work that you're doing is incredibly relevant, it's timely, and it's so important. Before we close, I'd like to ask each of you to tell us what lies ahead for you. What are you excited about as you think about the next chapter for the center? Let's start with you, Cass.
Thanks, Nina. There are two things that we're very excited about that will be coming up in our work. So one is continuing our research on the effectiveness of licensing, looking at the impacts on certain demographic subgroups. So what are the impacts of these policies on adolescents and emerging adults, and as well as racial and ethnic minorities? A second area of work that I'm very excited about is related to a different form of licensing, and that's concealed carry licensing. We have a team that's working to develop a virtual reality system that will test the appropriateness and accuracy of civilian gun use. And this has very important implications for how states and policymakers think about the ways they regulate civilian gun carrying in public.
Terrific, thank you. Shannon, let's go to you next.
So one of the things that I'm very excited about with regard to the center's work is the evidence that we're producing and the ability to communicate with policymakers, with stakeholders who are committed to this issue about what works and what's going to make a difference in communities. And what oftentimes makes a difference is not just assuring that we have good policies in place, but assuring that we have the infrastructure and systems in place to support implementation and enforcement of those policies. And increasingly, we're finding ways within the center to inform that side of the policy process, which is incredibly exciting for the future of our work and the impact that we can have.
Thank you. And last but not least, Alex, what excites you about the future of your work and the center?
There are a lot of important and exciting things that we're working on, but I think the two most exciting to me have to do with data collection. So I already mentioned trying to collect ghost gun data, but we're also working on a project that is designed to generate more reliable non-fatal injury data, which I think is a really exciting and new development. And the more data that we have, the better we're able to evaluate and develop evidence-based policy. But we can also look at really important details of the effects of these policies, like how they impact different communities and how maybe they affect disparities in violence and also disparities in law enforcement.
Thank you all. This has really been my great pleasure. I very much share your excitement about the next chapter for the center's work, especially as you build equity into the research and policy thinking that you're doing.
I started working on the gun safety issue a dozen years ago. Back then, there were so many gaps in our gun safety infrastructure, gaps in the background check system, gaps in our laws, gaps in our politics. But no doubt, the most glaring was the gaps in data on the issue of gun violence. And that's where the center at Hopkins has made such a difference. Whether you're talking about testifying on Capitol Hill, a meeting with state legislators, or even at a rally, the one thing that is consistent is our reliance on sound data. You can see the signs of the center's impact everywhere. It shows up on protest signs, on politicians' yard signs, and without a doubt, on the signs of the gun safety movement's progress over the past 25 years.
I rely really on the research, some of the policy research they've done that's really influenced the work that I do at the Educational Fund to Stop Gun Violence, includes the work that they've done on licensing, really opened my mind about what licensing is able to do, not just to stop homicides, but on gun trafficking and preventing suicides.
We've collaborated in a number of different ways. Most significantly, in 2013, we relied upon the center's and Daniel's research to put together the Firearms Safety Act of 2013. In that bill, we had a provision that required handgun purchasers to obtain a license and to give their fingerprints to the police before they could obtain the license. It was based on the research that had been done by the center, and it was probably the most important piece of that very important gun safety legislation. In addition, we gave the state police additional authority to oversee the operations of gun stores, and that also was based on the center's research.
Based on your findings, I introduced the Handgun Purchaser Licensing Act to incentivize states to require a permit to purchase handguns. States require drivers to obtain licenses to drive their cars in order to save lives. And your research demonstrates conclusively that requiring a gun owner to obtain permits does the same, saves lives. This bill was crafted with your input and based on your research. We must keep doing everything we can, including a push from the federal government, to get states to put these and other life-saving practices in place.
I knew to have an impact as an advocate, I needed to learn all I could. And as a new volunteer just entering the world of public health advocacy, I did not think anyone would have time for my multitude of questions. I did not expect world-class researchers to make time to guide and mentor and teach a newcomer. And to my surprise, everyone at the center, Professors Daniel Webster, Cassandra Crifasi, Shannon Frateroli, Jan Wernick, Alex McCourt, just to name a few, all found value in supporting advocates and fellow researchers at all points in their career and journey. And it wasn't just about teaching the importance of academics, but teaching and modeling the importance of working with those most impacted by gun violence, to fully understand the impact of those gun laws and the importance of the community programs on the ground. Seeing the work that those at the center committed to in Baltimore and working with gun violence interruption programs like Safe Streets made me realize that this was not the ivory tower I'd envisioned.
The team at Johns Hopkins Center for Gun Policy and Research are not resting. These researchers are on the front line, helping implement and devise ways to reduce violence. We can turn to so many examples in our organization's past, working with Dr. Daniel Webster to pass handgun purchaser licensing in 2013, working with Dr. Shannon Frateroli to pass the Extreme Risk Protective Order, working with Dr. Cassandra Crifasi on the Maryland Firearms Safe Storage Map, child access prevention legislation, and suicide prevention measures. Each of these researchers takes reimagining public safety from a slogan and turns it into a reality.
Right now, our agency is considering a number of interventions to address the rise in shootings and homicides that have occurred during the pandemic. The research led by Daniel Webster and Cassandra Crifasi around proactive investigative gun units is directly informing those policy decisions. Their last report, Reducing Violence and Building Trust, reframes their research in policing and gun violence through the lens of social justice, inclusion, and community engagement. The report is essential to any agency that seeks to rebuild a relationship with their community and address rising gun violence collaboratively and effectively.
As we look to begin the implementation of the group violence reduction strategy here in Baltimore, I know that the center will be working collaboratively as a partner with the city and our department. From my first day as commissioner here in Baltimore, Dr. Webster and his team have made themselves and their research available to me with the goal of working together, hand in hand, in this fight against violence. From police reform to implementing new policies and training under the consent decree, and most importantly, building trust, the Johns Hopkins Center for Gun Policy and Research has been instrumental in working alongside this department in providing recommendations for proactive enforcement.
One of the things I learned about data over the years is how it actually does tell a story. And one of the important things is being able to extract the data and put it in the story form. Like, how does it actually inform the work? How does it, what answers is it giving us? What questions is it raising? So I think that the center has been a vital part in that, because for years they have been evaluating programs and specifically around community gun violence. And that is the problem that's plaguing Baltimore the most right now.
It was great to hear from so many using our research and the conversation highlighting just a few policy areas where center faculty have established research expertise and leadership in the field. It's also important that the evidence that we produce is relevant to and reaches policymakers, advocates, and others working directly on efforts to prevent gun violence. Hearing from some of these individuals working at the national, state, and local levels about how our research has informed the work they do motivates us to keep pushing forward.
I couldn't agree more, Daniel. One key area of data and evidence where our center has become a national leader is public opinion polling on gun policy. Since January 2013, in the wake of the tragic mass shooting at Sandy Hook Elementary School in Newtown, Connecticut, our center has conducted biannual public opinion polls on specific and concrete gun policies. It's sometimes not enough just to say a policy works. We also need to know what people think about these policies to make change. Up next, we are so pleased to be joined by United States Senator Chris Murphy and Dr. Colleen Berry, Chair of the Department of Health Policy and Management and faculty member in the center. They will discuss the impact of gun violence on communities and the importance of using data to inform policymakers. They will also touch upon how policies like comprehensive background checks as part of a purchaser licensing system, like the one in Senator Murphy's state of Connecticut, can reduce violence. Following that conversation, we'll hear from Rebecca Williams, Director of Academic Innovation and Outreach for the Center, and some special guests who will share their perspectives on some of our youth-focused initiatives.
Senator Chris Murphy, thank you so much for speaking with me today in celebration of the 25th anniversary of our Gun Policy Research Center here at Johns Hopkins. You've been a champion in promoting evidence-based policies to reduce gun violence in America. Can you share a bit about why reducing gun violence is such an important issue for you?
Well, first of all, thank you for having me, and thank you for all of the fantastic work that Johns Hopkins does. We rely on it. If you've listened to virtually any speech that I've given on this topic over the past 8 years, you are likely to hear a reference to research that's been done at Johns Hopkins, because you are obviously best of breed when it comes to trying to dissect fact from fiction. And there's a lot of mythology when it comes to the issue of guns. So we're deeply grateful to everything that you've done, and hope that you're going to be around to help us for a long time into the future. Yeah, listen, I mean, I'm embarrassed that I have only dedicated the last 8 years of my life to this issue. I obviously was transformed by the experience in Sandy Hook. I was there that day and have come to get to know those families very, very well. That community will never, ever be the same. But I really hate the fact that I had not worked on this issue prior to the murders of 20 kids in Sandy Hook, because I grew up on the outskirts of Hartford, Connecticut. Hartford, Connecticut is a neighborhood that has endured epidemic levels of gun violence for over a generation. And I care about this issue of gun violence, not just because it now occupies the news a lot more than it did because of the pace of these mass shootings, but because I've learned how we're literally ruining a generation of low-income children of color who live in neighborhoods like the North End of Hartford because of their exposure to gun violence. I always tell people it's not a coincidence that the low-performing schools in this country are very often, or maybe by and large, in the neighborhoods prone to gun violence. It's because when these kids fear for their life every single day, walking to school or going to pick up milk at the corner bodega, it fries their brains. The trauma that these kids go through, fearing for their life, having to live through shootings on a regular basis, it renders them unable to learn. And so while we often talk about this epidemic of gun violence through the prism of deaths, right? 100 people dying a day from gunshot wounds, that just sort of scratches the surface of the real toll of this epidemic. And that's why I care about it, because I have learned over the years that as unacceptable as it is, that there are 100 people dying in this country from gunshot wounds every day, is just as unacceptable that a whole generation of children are having their youth, their education stolen from them because of the trauma that exists in this handful of neighborhoods. That's what drives me to work on this issue.
And you have a book on this topic, The Violence Inside Us, A Brief History of an Ongoing American Tragedy, that explores the history of violence in America. Your book was written before the death of George Floyd and before the sharp increase in gun purchasing that has occurred during the COVID-19 pandemic. Have the events of the last year changed your views at all on the strategies that we should be thinking about for reducing gun violence?
Well, I set out to write a book explaining why America has these epidemic rates of violence, and maybe more generally to try to explain to people why, as a race, humans are so prone to this kind of violence. And I ended up, unsurprisingly, writing a book about race before the summer of 2020, because there is no way to explain American violence than through a prism of centuries of racial oppression, centuries of violence being used by what I call in the book in-groups, largely over the last 200 years, white Americans, to keep oppressed and subjugated outgroups, by and large African Americans. The form of that violence has changed. It was, initially slavery, then it was lynchings, now it's incarceration and intentional impoverishment, but it's violence nonetheless. So I don't know that that anything over the last year has changed my perception. I think this has always been a discussion rooted in race. But what we have seen, as you mentioned, throughout this COVID epidemic is both record levels of gun sales and some very high elevated levels of gun violence, which just, I think, further proves the point that many of us have been making for years, that when you buy more guns, both in the legal and illegal markets, you have more gun violence. Contrary to conservatives' belief, more guns doesn't lead to less gun crime. It leads almost always to more gun crime. And I think that's what you're seeing in 2020 and 2021, a lot more people buying guns and a lot more gun crime.
So in our center at Johns Hopkins, we study many different policies for reducing gun violence, including things like purchaser licensing, background checks, temporary firearm removal policies like extreme risk protection orders, policies regulating gun dealers, safety training, and the list goes on. In your view, what are the most important policies that Congress and the states should be considering for reducing gun violence?
Well, I think we should just follow the research. I just think that we should do, what works. And part of the reason that I push the hardest for universal background checks is because the data tells us pretty clearly that that is one of, if not the most effective intervention. But it also happens to be the most politically popular. 90 to 95% of people think everybody should go through a background check before they buy a gun. And your research at Johns Hopkins showed, what happened in Connecticut when we imposed our universal background check system back in the 90s, about a 40% reduction in gun crimes, versus what happened in Missouri when they got rid of their requirement that everybody goes through a background check. They saw, a pretty immediate double-digit increase in gun homicides, and guns bought in Missouri all of a sudden started showing up in homicides being used all around that region. So, the data that you've produced tells us that universal background checks is really important. But as politicians, we all have an interest in getting reelected. And when 90% of your constituents support something, that probably is going to be a benefit to your reelection. So that's why I think our focus should be, on passing it first, a background checks requirement, and then moving on to some of these other interventions.
So politics has become incredibly divisive in recent years, and gun policy is often viewed as a highly partisan issue. Yet research by our center indicates, and you just alluded to this, that there are many policies for reducing gun violence that both gun owners and non-gun owners support, including many of those policies I just mentioned. Where are the opportunities, or are there opportunities to find common ground on this issue?
I think the first thing we have to do, and I think it's a really important question, maybe the most important question, what we have to do is just completely reject the idea that this is a controversial issue. It is controversial in Washington. It is controversial because the NRA has created a mythology around guns over the past 30 years that has taught people it's a third rail. It is not. It is not. Today, there are very few issues that bring Americans together more than the issue of guns. And I know that sounds totally wacky to say, but it is true. There's nothing that has 90% support in this country. Background checks does. Today, bans on assault weapons enjoys 60 to 70% support. The majority of Republican voters in this country today think that we shouldn't sell assault weapons any longer. This is a unifying issue outside of Washington. And so the key is to making a unifying issue inside of Washington. And the way that we do that is to just build up more power behind the 90%. I'm a big supporter of anti-gun violence groups, from Moms Demand Action to Giffords to Brady. They are organizing 90% of Americans. And in doing so, you will create more of an imperative for politicians to not listen to the groups that are representing 5 or 10% and listen to the groups that are representing 80 to 90% of Americans. So building up the political power of the anti-gun violence groups are really important, but also just rejecting, not sort of feeding into this narrative of the issue being controversial. That's really important as well.
So my last question, this can be a really tough issue to work on, and we've all been living in a particularly difficult period with the pandemic upending really every aspect of our lives right now. Where do you personally find the energy to press ahead with your own tremendous work on gun violence prevention?
I remember when I was in the state legislature, I passed a bill authorizing money for stem cell research, and we were the first state in the nation to do it. And I'll never forget this moment. I was a young, new state legislator. We were walking out to our cars at the end of a long day of debate on that bill, and a senior member of the state Senate said to me, "Man, there aren't many days when we get to make decisions here that affect life and death directly." And he said, "This is one of those days." And then he just got into his car and drove away. This is one of those issues, right, where a small adjustment saves thousands of lives, right? You just tighten up the nation's background check system, and you're going to save a life, 10 lives, 30 lives. And I think in many ways, that's the measure of our time in these offices, is whether we've made people's lives better, but whether we have stopped preventable death. And so I just pursue this issue with a passion, because I'm surrounded by all of these survivors and all of these victims and all the folks who have lost family members, and they give me inspiration, but also because I just know that of all of the issues that I work on, success here maybe has the biggest difference, maybe has the biggest impact on my country and my community and my neighborhood, and that certainly keeps me going.
Thank you so much, Senator Murphy, for taking the time to talk with me today.
Well, congratulations on 25 years.
An important part of our center's work is educating researchers, policymakers, and advocates alike. The voice of youth, however, has become increasingly important in our efforts to reduce the burden of gun violence. We are grateful to the David and Lucille Packard Foundation for their support in helping us develop the first ever free online course on gun violence prevention, as well as our first Summer Youth Institute in the summer of 2019. It gave us a unique opportunity to bring together youth from across the country to learn how to effectively use scientific data and incorporate evidence-based solutions into their efforts to advocate for change.
Through the Summer Youth Institute, I learned the importance of using evidence towards igniting change and the effect statistics and data can have in advocacy. I learned different ways on how to approach gun violence prevention advocacy, such as creating infographics and delivering social media content. But most importantly, I left the Institute with a community of students from all across the nation with different backgrounds and viewpoints, but with that same common goal: to reduce gun violence.
If I had to describe my experience at the Institute in just 3 words, I would say that it was rewarding, empowering, and insightful. One of the most valuable skills I learned at the Institute was how to deliver a compelling elevator pitch. I've already used this skill several times in lobbying the Maryland State Legislature just earlier this year.
So at the Youth Summer Institute, I learned how to properly analyze and use data and the impact of gun violence in different communities. And more importantly, I learned gun safety, the importance of gun safety, and the difference in gun storage methods. My advocacy work has greatly improved as I feel more prepared to discuss gun violence and storage in a more proactive way while still providing evidence to help prove my point.
It was nice to hear how the evidence produced by the center showing that handgun purchaser licensing with comprehensive background checks saves lives is propelling efforts to expand this policy to other states. This highlights again why it's so important that the research we do at the center makes it into the hands of those who can use it. And as we heard from Rebecca and some of our Summer Youth Institute alums, youth are such an important audience we connect with. Their voice is vital to advancing evidence-based efforts to reduce all forms of gun violence. The work these youth are doing to make their communities safer is so inspiring, and we're looking forward to seeing the amazing impacts youth advocates will make in the years to come.
Before we get into our next segment, we want to take a moment to remember an important friend who dedicated his life to preventing gun violence in Baltimore, Dante Barksdale, who was recently taken from us in an act of gun violence. Dante began his road to personal transformation when he became an outreach worker and violence interrupter in East Baltimore for Safe Streets, a community-based violence prevention program. He helped one of the most violent neighborhoods in our city go 2 years without a murder. Dante rose to key leadership positions with the city, helping hire, train, and support frontline violence prevention workers throughout Baltimore, while also doing the frontline work himself. Dante was a legend who garnered deep respect with violence prevention leaders across the U.S., and a friend of mine who inspired and taught me along with my students. Dante is just one of thousands of people we lose to gun violence every year. They're not numbers to us. We value their lives, mourn their loss, and care about their families who are forever impacted. Please join us in a moment of silence to remember those we've lost. Thank you. Reflecting on Dante and all the lives impacted by gun violence, we're reminded of the importance of supporting cities and communities in their efforts to prevent violence.
Thank you, Daniel, for that powerful reflection on Dante's life and the importance of centering this work on those impacted by gun violence every day. Up next, Daniel, you'll be joining Baltimore City Mayor Brandon Scott and Shantae Jackson, Director of the Mayor's Office of Neighborhood Safety and Engagement, for a conversation about the partnership between the center and the city on efforts to reduce gun violence.
My center colleagues and I have been involved in research and collaborations with Baltimore City officials in public health, law enforcement, and the mayor's office for about 2 decades. But I've never been so excited for our city and for opportunities for collaboration than now. That's due to the recent election of Mayor Brandon Scott and his appointment of Shantae Jackson as head of the Mayor's Office for Neighborhood Safety and Engagement. Welcome and thank you both for participating in our symposium. Mayor Scott, I want to direct the first question towards you. You've been a long-time believer in public health approaches to gun violence prevention. Can you share with us how you plan to address gun violence? And any thoughts you have about how the center has influenced your thinking about the issue?
Oh, wow. Thank you. Thank you, Dr. Webster, and thank you for having me. I want to first say happy anniversary, 25th anniversary to the center, and thank you for all the work that you have done to utilize public health and policy to make our streets more safe. I think for me, this is about the experience, the trauma that I've experienced, and the violence and how it's all connected. When I and the people around me, when I was growing up, experienced violence, it had detrimental effects on both our emotional and physical health. And as you know, in order to address violence, we have to get to the root of the issue, and we have to treat violence as a public health issue. We are going to address gun violence in Baltimore in an entirely new way. I'm looking to address violence with an all hands on deck approach. That's why we started the Mayor's Office of Neighborhood Safety and Engagement with Director Jackson leading that. You're the center's research shows that a vast majority of the guns in Baltimore is coming from a small number of individuals who we also know that is coming from outside the city. But for me, it's about making sure that we are getting out of the mindset that we're going to solely rely on our police department to reduce violence in our city. Yes, we know there'll be a role for that. That's about, as you know, and learning, and I have learned, one of the ways the center has helped me over the years is about targeted enforcement and approaches, focusing in on, as you and I have spent hours talking about, not every little minor crime or going back to the days of zero tolerance, but focusing in on those small groups of individuals who are committing the overwhelming majority of the violence in the city. We're going to be doing that under Director Jackson's leadership in partnership with our police commissioner through fully implementing a group violence reduction strategy. We also have to understand that we're going to target individuals in a different way. We will target gun trafficking, but it's also about the other things that we can do. You and I have walked and talked a lot about our safe streets and our violence interrupters in the city of Baltimore. We know the success and the early success we've had for our program, but we now also know that we have to take that further. We have to go to Safe Streets 2.0 and make sure that those individuals are being able to not just interrupt violence, but connect folks to other opportunities. Every other city agency also has a role in this, and that will be part of Director Jackson's focus. Is we will make sure that DPW, housing, rec and parks, health, partner with our schools, partner with MOED to make sure that we are doing everything as a city government in its entirety to impact the environment in which violence has seemed to thrive in our city for far too long.
Well, I'm very excited about the opportunities ahead and your leadership in this. I want to turn now to Director Jackson, and I also just want to pause for a minute to connect and reflect upon Dante Barksdale's work and contribution, probably to all of our thinking about how we should be addressing violence, particularly as a public health problem. Director Jackson, you're now in a key leadership role in community safety and engagement. In a report from the Public Safety Committee that I served on, we noted a direct connection between the level and types of supports offered in programs that are reaching the highest risks for gun involvement, like Safe Streets. What are your top priorities for strengthening and expanding community violence prevention in Baltimore?
Thank you so much, Dr. Webster, for having me today. So I would say that in reading your report and also hearing directly from Baltimoreans, the mayor's approach is the approach that I'm looking to implement, which involves creating capacity for community-based organizations. And creating that capacity isn't just a matter of providing technical assistance associated with how to write a grant or how to engage with community members, but it's also about becoming an intermediary through which community-based organizations can apply for grant dollars so that they become co-producers with us, with BPD, with city agencies, in creating the neighborhood safety that they believe that they need. In addition to that, the mayor also mentioned this a bit ago, making sure that we reevaluate what's worked well with regard to our Safe Streets implementation and taking the time to do some research around culturally, operationally, from an implementation perspective in partnership with you and others, what's working well and what should change. We have seen some hybridization of the Cure Violence approach across the country reap significant results and benefits in communities. And we're going to be looking to do that here, making sure that it is culturally relevant, contextually, geographically relevant for the city of Baltimore.
Well, that's great. I'm going to end here, I think, asking what I recognize as a big question, but I'd like to just sort of get some general thoughts. We know that, we need to focus on those at highest risk, but there's also the set of conditions that create that risk. You can think of this very specifically in terms of abandoned houses and issues like that. But connecting this actual to structural racism, what are your general thoughts about how this administration can start to address some of those issues as a way to make communities safer?
Yeah, thank you for that, Dr. Webster. And I think that, listen, we have to understand that the Baltimore City that we live in today in 2021 is directly connected to Baltimore City being the first place to have a racial redlining law passed. It was weaponized here in Baltimore and taken everywhere else. And the only way, Dr. Webster, that you're ever going to undo racism and inequity that was caused through policy is by changing the policy and changing the actions that come from those policies. We know that I actually sponsored and passed Baltimore's equity law, and now my administration, fate would have it, is going to be the one that has to implement it. And what we have to do is start to deal with all the things that you mentioned. One, the city has to start to invest its money in those neighborhoods, right? We can see that the studies that show how our capital money is spent in the rich white neighborhoods and not the poor black neighborhoods that were redlined for many years, and the environmental things that come out of that lead to violence. When you start to invest in those neighborhoods, in the people there, you will see a long-term, this is how we can see the long-term impacts of reducing violence in Baltimore. This is not an either-or approach. Yes, we have to focus on the immediate day-to-day, and we will do that continuously and do it in a better way. But we also have to make sure that we are spending our capital dollars, our operating dollars, to benefit people in those neighborhoods, having strategies to deal with vacant houses, making sure that we're dealing with folks who are re-entering into our community in a more improved way, making sure that we're providing educational opportunities for our young people and adults to be able to obtain career and job placement here in Baltimore that will provide for their families. That's how you're going to do that tough work of doing it. And that's not easy work. And that for sure isn't overnight work, but somebody has to be at the ground foundational building level. And that's where we are. We are trying to build a new house for Baltimore City. And we're at the foundation so that we can one day put the shiny thing on the top of the building.
Well, Mayor Scott and Director Jackson, my colleagues and I at the center are eager to collaborate with you and community partners to help you achieve these goals for reducing violence and advancing equity and justice. We thank you so much for your leadership and for your partnership with our center and, of course, participating in the symposium.
Daniel, it was great to hear your conversation with Mayor Scott and Director Jackson on efforts underway or being planned to reduce gun violence in Baltimore. I'm excited and inspired to continue working in partnership with Baltimore and other cities to implement and evaluate community-based strategies to reduce violence. The discussion with Baltimore leaders touched on key pieces of our work, including community-focused efforts that reduce violence and reforming policing with an emphasis on racial justice. To dive into this a bit deeper, Professor Cammie Chavis from Wake Forest University is going to join you for a brief discussion on the importance of racial justice as it relates to reducing gun violence.
Hi, I'm here to welcome Cammie Chavis. She's Vice Provost at Wake Forest University and Professor of Law there, who directs the program in criminal justice. She's also one of the leading experts on racial bias in policing and criminal justice issues. I've asked Professor Chavis to discuss one of the most important aspects of gun violence prevention right now, and that's addressing structural racism and promoting racial justice while we're also trying to prevent gun violence. Our center just completed a strategic plan It lays out multiple goals and specific objectives relevant to racial justice, diversity, and inclusion. Professor Chavis, what do you see as the most important things our center could be doing in the months and years ahead on this issue?
Thank you very much for asking me to be a part of this and to talk with you today. I think that helping communities, I know that one of the goals you have is to assist community-based organizations and to assist the city in helping to alleviate the scourge of gun violence. And I think having this multifaceted approach, but where you are bringing in these community organizations to help them identify and set their own priorities is so important. I think that with the criminal justice system, we see there's a lot of opportunities for reform in terms of reforming the criminal justice system, but so critical to that reform are the people that are most impacted being able to have a voice. So I think that your center in helping to give voice to the community-based organizations and helping them set their own priorities for reform is imperative.
Well, that's great. That's certainly how we approach one of our most recent projects on this in Baltimore. We went into the communities most impacted by both gun violence as well as racially biased policing practices to learn exactly what you said, what they actually want and need from police, which is a combination of less of the minor policing issues and really focus on what their issue is, which is too many shootings. Do you have any thoughts on ways that an academic center like ours could really kind of take this to a next level? We're at a really important time in history. What last thoughts do you have about new areas or new ways that we can be impactful?
Right. Well, it's interesting because something that you said, and I know that you have worked on, but again, helping. I think that so many people do not understand the link between policing or biased policing or aggressive policing and the root causes of some of the violence. And so I think that, again, helping folks to understand the link there, that if you're in a community and you feel either unfairly targeted or the practices that you see used in your community are vastly different, more aggressive than what's used in other communities, you will begin to think that, well, this system is unfair and I don't want to cooperate with law enforcement officers. And that it's very difficult then for communities to forge the necessary partnerships they need to alleviate the violence. So I'm glad that you're already doing that. I think that in the future, again, once people have articulated how they want their communities to be policed and setting those priorities, again, helping that come to fruition. Another thing that I would say is just this intersection that we have between law enforcement and technology, and thinking about how we can use technology to help solve crimes, but also using that technology responsibly and with community consent and in partnership with the community, because I think that is the new frontier. I think we're already here, but it's almost a new frontier in criminal justice reform is the responsible use of technology.
Well, those are great words of advice. I agree with all of them. Technology actually is issue that we also have worked on. And so doing that in close partnership and allyship with the communities that are going to be most affected clearly is key. I really want to thank you for joining us and for your cooperation and work with our center in recent years and hopefully moving forward. I really appreciate appreciate those insights from Professor Chavis. Ensuring that work to reduce gun violence is centered on community needs and racial equity will continue to be an important part of our center's work. Now that we've reflected on some of our work over the last 25 years and future directions, there are a few more exciting things we'd like to highlight. We are so pleased that Dr. Jackie Campbell and Dr. Otis Johnson have joined our center as core faculty. Dr. Campbell is the Anna D. Wolf Chair and Professor in the School of Nursing and led research that has been foundational to gun policy. It demonstrated that gun ownership by men who are violent with their intimate partners increases the risk of intimate partner homicide 5 times higher than in situations in which abusers do not have firearms. She's leading new research on this topic with additional populations, complementing the center's research on policies to disarm individuals who are violent. Dr. Otis Johnson is a Bloomberg Distinguished Professor in Education and Health Policy. His research examines the intersections of neighborhoods, social policy, law enforcement, and race. His study of fatal civilian interactions with police is critical to the center's goal to advance research that contributes to needed reforms that will reduce disparities in gun violence. We're thrilled to have these national experts as colleagues contributing to our mission.
This past year, the center underwent a strategic planning process in collaboration with various stakeholders and partners. We're proud to announce some of the core components of our strategic plan, including enhancing the center's diversity and inclusion and attention in our research to racial equity and justice, continuing to produce rigorous and policy-relevant research to address pressing questions, advancing our understanding of public views on policies and programs to reduce violence, supporting cities and communities in their violence reduction efforts, and continuing our innovative research translation and educational activities to ensure our work reaches a broad audience. To encompass the center's current work and new initiatives, we are pleased to announce we are changing our name to the Johns Hopkins Center for Gun Violence Prevention and Policy. Under this new banner, our faculty, staff, and students will continue to generate science and innovative strategies to prevent gun violence and promote justice.
Our contributions to gun violence prevention over the past 25 years would not have been possible without the generous support of foundations such as the Joyce Foundation, Bloomberg Philanthropies, the David and Lucille Packard Foundation, Arnold Ventures, and the Smart Family Foundation of Illinois. A special thank you to Pam and Chris Hohensarik for their generous support. While there have been recent federal investments in gun violence prevention research, the funding is not sufficient to effectively address our gaps in knowledge. Support by foundations and private donors will continue to be integral to ensure we can sustain and advance our work of conducting rigorous research, training future researchers and practitioners, and translating our evidence into effective policies and programs to reduce violence. If you're interested in making a gift to the center to support gun violence prevention, you can go to our website and visit the giving page, select Other as the designation, and enter Center for Gun Violence Prevention and Policy. Any amount of support is a significant investment in public health and violence prevention. I'd like to share an exciting announcement. Thanks to Pam and Chris Hohensarik's generous support, as well as Johns Hopkins University, a new endowed faculty position has been created within the center, the Dana Feitler Professor of the Practice in Gun Violence Prevention and Advocacy. This leadership position will ensure that the best research on how to prevent gun violence is translated into effective policies, programs, and practices. Thank you, Pam and Chris, and to our funders for investing in our work.
Thank you also to our center faculty, staff, and students who strive every day to reduce violence and promote justice. And thank you to everyone who so thoughtfully participated in and contributed to today's symposium. A special thanks to Caitlin Hoffman, our center's communication director, who helped pull this event together, and to Ninja Traffic, who produced our video content. We hope you'll stay connected with us at our website and on our social media channels for exciting updates on the work of our center. Please note, our social media information will be changing after the symposium to reflect the center's new name. Please follow us at JHU_GVP. We're going to end with some messages from a few special guests. Thank you so much for joining us for our 25th anniversary symposium, and we look forward to the next 25 years.
Thank you for your hard work. Let's get her done.
So my message on your 25th anniversary is simple and it's heartfelt. Thank you.
Congratulations on this anniversary, and I look forward to seeing all the center will accomplish over the next 25 years. I join you in our shared vision for a future where people in our country are safe from the harms associated with gun violence.
My wish for the next 25 years is your sustained energies and your sustained commitment to this work. My wish is that the center's work continues to drive evidence, programming, policies, and advocacy to reduce violence in communities here in Baltimore, across our country, and certainly across the globe. So to you all, to you Daniel, to you Cass, and to all of you affiliated with the center, cheers to 25 more, and congratulations.
Thank you to the entire family at the center for your persistence and your dedication to the cause of saving lives. We need you on the front lines of this important mission. Congratulations on your 25th anniversary.
We deeply appreciate all the work that the center has done, that Daniel has done to help Maryland become a safer place, and we hope to be able to continue our collaboration for many more years.
Here's wishing you all another 25 years of success, and even more fervently, here's wishing all of us a future in which programs like ours won't be necessary.
Congratulations on the 25th anniversary of the Johns Hopkins Center for Gun Policy and Research. I wish you all continued success and growth as you continue to be at the forefront and have an impact on crime and gun violence.
It's been an exciting 25 years. I'm confident that the center will have at least 25 exciting more, and I'm just so excited to be a part of it.
I give a huge congratulations to the center and its illustrious faculty and staff for this milestone anniversary. Congratulations.
I'm grateful not just for the policies I've learned, but for the generosity and kindness of those who gave me the tools to continue my work to end gun violence in all its forms.
I wish you all a very happy 25th anniversary, and I look forward to working with you over the next 25.
Happy 25th anniversary, Johns Hopkins Center for Gun Policy and Research. I will stick around and collaborate with you for the next 25 years.